Thank you for joining us this evening. Today will be our second virtual open house for our MAS program in Humanitarian Health. Your presenting this evening will be myself, Angelica Santiago. I'm an admissions officer for the online program, and Dr. Paul Spiegel. He is the program director for this master's degree. Right, so your presenters for this evening will be myself. My name is Angelica Santiago. I'm an admissions officer for the online programs. I've been working in higher education, particularly with online programs for the past almost 6 years now. It'll be 6 years in April for me. And I've been working with the online programs here at the Johns Hopkins University Bloomberg School of Public Health for the past 3.5 years. Also working with this particular program since the onset and inaugural start last year. Dr. Spiegel, if you can please take a minute and introduce yourself to our audience this evening.
Sure. Hi, everyone. My name is Paul Spiegel. I'm a physician epidemiologist from Canada originally, and I'm currently a professor of practice at Johns Hopkins Bloomberg School of Public Health. I direct the Center for Humanitarian Health, and I'm the program director for this particular Masters of Applied Science.
Thank you. So
Go ahead, Angelica.
Perfect. So just to let everyone know what we will be covering tonight. So on the agenda, Dr. Spiegel will be giving us an introduction into an industry overview. This program was started last year for the Johns Hopkins University Bloomberg School of Public Health, and Dr. Spiegel is going to take some time to discuss why this program was designed specifically and why it's being introduced and encouraged to early and mid professionals to be able to gain specific skills to be successful in the humanitarian field. He will then be going over program details and curriculum, so giving information about the specific courses, a little bit of insight into what students will be experiencing, the skills, concepts, tools that they'll be gaining in the program, and then an introduction into what the online learning looks like here at Johns Hopkins University. The university itself has over 20 years of online experience, and Dr. Spiegel will give a little bit of details as far as the support that's offered and the different experiences that you would have week to week in an online class like this. He'll then take some time to go over one of the highlights of this program, which is the very diverse an interdisciplinary approach of the faculty. So you'll get an insight into who was teaching the classes, what are their backgrounds, what are their specializations, and what they bring to each and every one of our students in this program. I'll then take over to talk a little bit about the admissions requirements, particularly a little bit more about what is expected of students from a professional standpoint as well as academically. And then go over the tuition and financial aid information and discuss the scholarship opportunities through this program. We'll be saving some time for some Q&A at the end, so if you are listening to the presentation and that sparks any particular questions for you, please feel free to type them right into the chat box at any point. We'll be looking over the questions, taking them down, and making sure to get to them at the end of the presentation. So thank you for joining us this evening, and please enjoy.
Great. Well, welcome everyone. And I'm going to talk a little bit about some of the reasons why we started this program. And we're actually quite proud of this because we have currently the Masters of Public Health in-person program, which within that's the MPH, the Masters of Public Health for Humanitarian Health, and we have students every year from all over the world that take this particular program. And the aim of this program is to develop the experience, the expertise, and the knowledge to be able to respond to humanitarian health emergencies. But what we found was that both in terms of time, in terms of having to be there in person, in terms of cost, and it wasn't possible for everyone that wanted to be able to get involved in humanitarian health to participate in the MPH in person. There is an MPH online as well, but that doesn't have a humanitarian health focus. And so we decided to create this Masters of Applied Science in Humanitarian Health for primarily mid-career professionals who either wanted to or needed to continue working, but also wanted to get a master's degree from Johns Hopkins in this particular area. Please feel free to read the slides. I won't go over in detail some of these issues, but what we found, so my previous background before coming to Johns Hopkins 2.5 years ago, I actually did do my MPH 20-something years ago here, and I did my preventive medicine residency here. But before that, after my MPH, I was with Centers for Disease Control in the US, dealing with humanitarian emergencies, and with Doctors Without Borders, Médecins Sans Frontières, and Médecins du Monde. And then I spent the last 14 years or so at UNHCR, the United Nations High Commissioner for Refugees, where I was in charge of the technical programs for the agency. And what we found is that there was a gap of public health professionals, both within the UN, but within international NGOs, people that really understood the situation, that had experience, and that were able to help to respond and coordinate to emergencies. And so this program is really made for that group of people. I think what I want to emphasize also, that's very, very important, is this is not for domestic emergencies within the US or elsewhere. It really is for international global health emergencies. We look at natural disasters, but our focus much of the time, and for the majority, really is conflict, forced displacement, and broad issues of migration. And so I think that's very important. Actually, just go back one slide so I make sure I've got everything. Yes, there are a lot of changes currently in the field, and so that's another reason why I think this program is really important. I just finished a lecture today called Humanitarian Development Nexus, where we're looking at now, and the humanitarian world as well as the development world are recognizing that we can't have this divide between the humanitarian and development world. And so how do we start trying to bridge that gap? There are major financial issues going on right now where emergencies are quite prolonged, and there just is not enough funds out there. So we need to find donors beyond the primarily Western donors, but we also need to look at innovative financing. Let's look at the private sector and other ways that we can address these issues. So there's a tremendous amount of change right now going on. Another issue is cash-based interventions, moving to give people cash, ATM cards, as opposed to in-kind, meaning food and tents. This is a very, very big and important shift that will have huge implications for how we respond in the future, as well as coordination and the number of agencies that do respond. Next slide. So what our goal is to ensure that our graduates have the necessary tools, expertise, and that they're up to date, so that when some of our students in this first cohort are already working in this field, but when you're working in the field, as you know, and you have other demands on your time, it's really hard to keep up to date. And so what we've been doing with these students is working and using their experiences, but trying to explain where the field is going. And as I said, I gave some examples like the Humanitarian Development Nexus. There's a big issue in terms of humanitarian principles and how international NGOs and the UN can remain their neutrality and independence when working or not working with groups like ISIS or the Taliban. We need to respond to the current populism and anti-migration, anti-refugee feeling right now that is occurring, not feeling, but policies, both in the United States and Europe and elsewhere. So that's one big area. The other area that we're focusing on is for this to be interdisciplinary. Humanitarian health is just inherently well, public health is inherently political, but humanitarian health more so. So we have courses where we bring in folks that have political science expertise, management and leadership skills. So we have a broad area. And we have many lecturers that are, particularly in some of the areas where we're expanding, that are not necessarily from Johns Hopkins. We do a lot of interviews because of my and other connections with the people in the field. We do a lot of interviews with very senior people to understand how they are making their decisions, for example, in Ebola right now, or in Yemen, or in South Sudan. So we try to bring in a broad group of people. Excuse me, next slide, please. So we are looking also at not just an acute emergency, but we're, in fact, more and more, as I mentioned, these emergencies are prolonged. We need to better understand preparedness, and we need to consider longer term issues. When a refugee stays a refugee for 13 years, and some numbers even have it up to 21 years, we need to consider beyond just their immediate health needs, but their broader public health needs and even their livelihoods, so that they can eventually start considering and having a life with dignity beyond the emergency phase. There's no question, sadly, that there are the job opportunities for when one graduates in humanitarian health are very, I say unfortunately, because we see it's getting worse and worse in many situations in terms of the new conflicts as well as the prolongation of these conflicts. So I don't think it's very difficult to be able to find jobs. It's one of these few professions where we would like to not have a job if we didn't, if their conflict and forced displacement was not occurring. But given the current political environment that we see right now and the dysfunction at the highest levels in the Security Council, I think it's sadly very safe to say that there will be more and more large-scale disasters. We're just waiting to see what's happening right now in Venezuela, but already 3 million people have fled Venezuela into surrounding countries. Yemen is on the brink of starvation. So it's a tough time in the world, and I think the skills that and the expertise and the knowledge and the awareness of how the humanitarian community works, I believe strongly will be very important for those of you that take this degree and want to have a career in humanitarian health. The jobs are broad, so humanitarian emergencies and disaster response agencies. Again, we don't deal with domestic emergencies. We deal mostly with international emergencies and a focus on conflict. Non-government, there are international and national NGOs, many United Nations agencies, Centers for Disease Control and Prevention, similar agencies, various think tanks and policy organizations across the world need these sort of people that have expertise in humanitarian health in the broad sense. Next slide. So some of the program details, it's 49 credits. We're going to go over and I'll show you some of the specifics. There's a mixture of courses, professional development, and an integrative activity, which is in the second, well, depends on how many years one takes to do this, but is in the latter half of the program. We try to be as skill-based as possible. So we do give a lot of lectures on PowerPoint. We also, there are many assignments that are case-based, context-specific, so that one can use the skills that one has learned from the various lectures that you've seen online. It's a unique program in that it's part-time, and everyone that has been taking it in this first cohort is working full-time in their job. And it is 100% online, and that's very, very deliberate, because we wanted people from across the world, and we are aware that some people, particularly in this administration, visas are an issue, and so it's 100% online. One is not required to come into the United States. We are doing group learning. Because it is online, we have a lot of different ways to try to interact with people. So we have what are called live talks. So usually twice a term, and these terms are 8 weeks. So once a month, we are on a call, a live talk where people come in, and then we speak specifically about the course and take questions. We sometimes bring in other speakers. And then we have a discussion forum, which can be quite lively. And we have both teaching assistants as well as the professors that get involved in that. Next slide, please. So this is the curriculum, year 1 and year 2. It doesn't mean, though, that everyone is going to be doing this in 2 years. And in fact, many people will likely do this over a 3 or even a 4-year program, because it depends on your current job and what you're able to handle in terms of the number of credits. So if we walk through year 1, and then what we have here are the terms. When you see in year 1, we have the terms 1, 2, 3, 4, and then year 2, terms 1, 2, 3, 4. And the first year is 24 credits, second year 25. So walking through each of these, so each line is a course. The first one is an academic and research. It's 0 credits, but it's required in order to take these courses. We then, Public Health and Humanitarian Emergencies is a 4-credit broad introductory course that I lead on that course. There are numerous lectures, and it covers the gambit from protection to resettlement to health, wash, shelter, logistics, coordination. It's meant to be a introductory to make sure that everyone is on the same page. And then you will see throughout the various courses, we go into much more detail, and we take all of those lectures and become a bit more profound. Then there is a course that is in seminars in public health. And I should say that some of the courses are very much humanitarian health specific, such as the Public Health and Humanitarian Emergencies course. The seminars in public health is a broader course on public health, and students beyond just yourselves in the humanitarian health, but other students who are doing Masters of Applied Science may take that as well. The next, in term 2, is design and planning of primary healthcare projects. And this is Gilbert Burnham and other colleagues that are teaching this. It's a 4-credit course, and there is a humanitarian health component to it. And then there is a disaster preparedness, which is very specifically humanitarian health. It's 2 credits. This concentrates more on natural disasters, but it also has and natural disasters and epidemics. And it's concentrating more on the preparedness, everything from international health regulations to disaster preparedness planning. Johns Hopkins is famous for its epidemiology and its biostatistics. And so every Masters of Applied Science student, if they're taking, it depends from GIS to hospital management to humanitarian health, has to take certain courses. The introduction to EPI is one of them. And some people are afraid of EPI and the biostats, but this is, these people have been teaching this for so long, and it's an excellent course, but it really is important in humanitarian health, even if you're not going to be an expert in epidemiology or biostats, to clearly be able to understand at least how to read reports, how to read studies, looking at data and interpretation. So the intro to EPI is 4 credits, and that's a much a larger course where other students will take as well. And then the third term as well will be water and sanitation in humanitarian emergencies. That's 2 credits. I also lead that course. That one is, I think, quite an interesting course where I've went outside of Hopkins to around the world to be able to get experts in WASH and humanitarian emergencies. That's currently ongoing in our first cohort and will end in a few weeks. In term 4, we move to statistical concepts in public health. It's more of a biostatistics course. That's a requirement that everyone takes in all of these master courses. And then we move on to social and cultural basis for community and primary health programs. And that is also Professor Bill Brieger, who's had years in the field working primarily on community and primary healthcare programs. It's broader than humanitarian health, but has a humanitarian health component. So that takes us through the first year. In theory, if everyone was taking full-time credits, which we don't expect everyone to do. And each of these courses are offered every year. So if you miss a course one year, you're able to take it the following year. Walking through year 2, there is assessment approaches in humanitarian health. This is by 2 professors, Cortland Robinson and Shannon Ducey. It's again, it's a unique course, and it's very, very important because this allows us to be able to look at different methodologies, looking at assessments and monitoring and evaluation in humanitarian settings. There are a lot of challenges to deal with data and to deal with trying to get good health information system data in humanitarian settings because of the fragility and the constant movement of people, the insecurity. We recently just finished a big report on cholera in Yemen. There were major issues there, and one of the reasons is the insecurity and not being able to get into those remote areas. So how do you deal with this, and how do you learn to deal with bad data, or at least poor quality data? So that's a really important course. The next one is Health Needs and Service Provision in Humanitarian Emergencies by Professor Gilbert Burnham, who's had, I think, 50 years of experience now in this area. And this one concentrates more specifically on the health needs. It's much more clinically focused, but you do not need to be a clinician to be able to do this. So, but it talks about very much the health components in everything from community to primary health care, secondary referral care, and to tertiary care. Then in term 2, we have 3 2-credit courses, all I think exciting. One is nutrition and food security in humanitarian settings. Enough said. I mean, these issues of everything from famine to severe acute malnutrition and what happens when people move and there's just not enough food is hugely important. Professor Shannon Ducey teaches that. We then do leadership and management in humanitarian settings. We're just finalizing this course. It has not existed in the past, and we're actually very excited. We have an expert in leadership and management theory named Cyrus Engineer, and then Maya Tessa Vevers, who was previously with ICRC, the International Committee for the Red Cross, and IFRC, the International Federation for the Red Cross and Red Crescent. She will be teaching this together with myself, and we're talking about management and leadership theories, as well as now then giving examples and interviewing people all over the world who have had to undertake management and leadership in humanitarian emergencies. As you can imagine, when you look at what's happening in Ebola, in Democratic Republic of Congo right now, it's incredibly difficult, and you have to make very, very difficult and life-defining decisions. Then another course that is very important is ethics, dealing with ethics and global health practice. Hugely important, and humanitarian emergencies is part of this. So that's in term 2. Term 3 is human rights in humanitarian emergencies, 2 credits. Cortland Robinson will teach that. Right now, we're under siege to a degree. There are a lot of human rights and humanitarian law, but a lot of things are changing right now, and we need to better be able to understand what are the Geneva Conventions, what are humanitarian principles, how are they changing now, and how can we respond to that? So that's an important course in term 3. There's a 2-credit professional development workshop, writing for results. And then another area that massively important in humanitarian health is mental health. And we have some of the leaders in the field who research and respond to mental health and emergencies. And the two people that will be teaching this are Professors Judy Bass and Vitsi Toll. Vitsi lives full-time in Uganda, where he does this mental health in various emergencies and non-emergency situations in Uganda. And then finally, term number 4 in year 2, we have non-governmental organizations administration of global health programs. This is a really important course because responding is not always sexy and exciting. We need to understand the financial, the administrative components of particularly working with NGOs, of whom the majority of our graduates will end up working with. We need to understand, how do we do plans, how do we do, what's the program cycle, and how do we deal with the financial and human resources. So that deals with that component. And then we have an integrative activity, and that one starts much earlier in year 2, but it is, the idea here is that either we will have some for you, and or if you have specific, you're already working in your job, it's meant to be much more practical and operational, and to use all of the knowledge that you've had from the first year and 3 quarters to be able to apply that. Next slide, please. Okay, is this over to you now, Angelica?
Oh, I can talk through a little bit of the online learning, but I definitely want you to be able to give some insight into the live sessions, the periodic live sessions. Sure. So overall, our online learning has been online for 20+ years. So while this program is relatively new, the program itself, how classes are delivered, is not new. We use a system called Course Plus that was designed specifically here at the Bloomberg School of Public Health by a team of faculty and learning technologists that created that online platform. The platform itself is very user-friendly. I would say if students have any previous experience working with like Blackboard or Angel, in my academic background, I worked with Blackboard, and I feel like this is much user-friendly. It gives a separate place where you do have the course assignments, but you also have a course discussion board, which is regularly monitored by both faculty and TAs, teaching assistants in the classes. So a lot of ways for students to engage and have dialogue. So even though you are in 100% an online program, you're not in a place where you are over there by yourself, on a little island by yourself. There's a lot of different ways to engage. There will be faculty recorded course lectures to provide increased flexibility so you can listen to them in your own time, along with any reading or writing assignments that you are doing. And of course, there is a 24/7 help desk, since we know all of our students are in different time zones. The only thing that is delivered at a certain time is the periodic live sessions. Those, and Dr. Spiegel, feel free to correct me if there's any changes, but those are delivered every 2 weeks or every other week. And it's an opportunity for students to engage live with the professor, where the professor will speak on a topic for roughly about an hour, and there will be an opportunity for students to have a chat box open and put in their questions and get answers in real time. That does have flexibility, as we do understand all of our students are in different places, both domestically and internationally. So if there is a chance that for one session it works out for you and you can attend and be part of that live, that's great. But in 2 weeks, if a work assignment requires you to be away during that time period, which is usually in the evenings Eastern time, but if you cannot attend, that will not be held against you.
Maybe just on that, Angelica, to say that they're all taped, and so if you're not, often they're between 5 and 6 p.m. Eastern Standard Time. We can change them according to, or we can even alternate them in terms of, we can sometimes have it at noon and sometimes in 5 to 6, but they're all recorded and then they're put up on Coursera, Course Plus, our online learning, so that everyone can listen to them even if they can't participate live.
Perfect. And if students have questions in advance, would you say that they are able to submit them if they know they can't attend one of those live sessions, can they submit a question in advance? That way they can have it answered during that session?
Yeah, of course. And then we're quite flexible. So many of the students, in fact, nearly all of them in this first cohort, some of the faculty have been speaking to them offline about other issues that have come up. So it's absolutely, they can ahead of time. I've had some students who have said we'd really like to either speak to a specific person or we want to talk about this particular subject. The upcoming live talk in a week or so, we're actually going to have a student present because she was spending time in Kibera in Kenya. But I would say it's not every 2 weeks. It depends on the professor. And we've instituted something now where every month, on top of the live talks, we have a conversation, an open, we have a time once a month where myself and then potentially some of the other, Cortland and Shannon, we have the equivalent of like a Skype, it's called Zoom, where we're open and we just talk about anything related to Opal that is not related necessarily to the specific course that people are taking.
Perfect. Zoom's a great feature. I've heard a lot of great feedback from students on that, so thank you. To move forward, if you can please kind of give some insight into our faculty, as you were just speaking about, Cortland.
Sure. So our faculty is broad, and I can even see here now we will have some additions. Going through, I probably won't go through all of them, but I will just say that most of our faculty have had experience beyond just academia. Some of them are part-time faculty and then are actually working in the field. And we have a huge, you can just see here, we have a mixture of physicians and Masters of Public Health and PhD students. And I'll just choose a couple so that to give you some examples. So for example, all of us are, I hope are experts in public health, and many of us in humanitarian health. Some have a broader experience in community-based situations of primary health care. But then each of us have generally an expertise, an area where we're very much involved in terms of our research. So if we look here at Cortland Robinson, who's a PhD, his expertise, well, he has many. He's actually a demographer by training, spent years working and studying North Korean situation, primarily North Koreans coming into China. His current expertise is more on human trafficking and early childhood marriage, and so he's doing a lot of work on that. Len Rubenstein is underneath Cortland is a lawyer by training. He was the CEO of Physicians for Human Rights for many years, and his expertise is more on ethics and international humanitarian law in these areas. Lauren Sauer, underneath him, is her expertise is more on disaster preparedness and stronger in natural disasters, as is Dan Barnett. Judy Bass, I jumped, so if you look to the left, third one down, Judy Bass's expertise is on mental health. Shannon Ducey, jumping down again, is her expertise is, the expertise is broad. Let's say her focus is on nutrition and food security and cash-based interventions. And Ambrosy Edwards, her expertise, for example, is very much on community focus and behavioral components. Yes, I think I'll stop there, but I mean, it's broad. And for instance, the management and leadership course, the people that are teaching that, Cyrus Engineer and Maya Bevers, aren't here yet because that course will only start this coming school year. But their expertise is quite different and diverse.
Perfect. Thank you so much. So I'll give a little bit of insight into the admissions requirements and talk through just a little bit more. A few questions that we have are coming up in this area, so hopefully this will answer it. If not, we will definitely elaborate on it in the Q&A session. So all of our applications are processed in an online portal called SOPHIS. This is a third-party application portal that public health schools utilize. So all applications will go through the online portal. Students are expected to have a completed bachelor's degree from an accredited college or university and a minimum of 2 years of public health work experience. Part of the application will be to provide a current resume or CV showing that experience, to acquire 3 letters of recommendation. Again, this goes through the online portal, so very user-friendly. You basically put the name of the individual and their email into the portal, and it will generate and send them an email on your behalf. So it's a very streamlined process, and it gives them instructions on how to upload a letter for you. You'll then be writing a statement of purpose. This is your opportunity. It is an open-ended statement, but it's your opportunity to really talk about your career goals and the compatibility of your career goals with the educational objectives of the program. So what our admissions committee wants to know is why this program? What has prepared you to come into this program? What has made you interested in this program? And what skills do you want to gain? How would you hope to use those skills in the future? For our international students, there are 2 requirements down here that you will see. There is a proficiency in English exam that is required, either through the TOEFL or the IELTS. And there is an academic evaluation required for any education completed outside of the United States. So if you have attended any academic programs outside of the United States, it is required that you get a course-by-course credential evaluation. One service to utilize is the World Education Services. And this is something that we work closely with students on as they are in the application process. In my office, we have application specialists who can assist students through this process. I know there's a number of different questions that come up, and always feel free to reach out to us. Even the most smallest question, if you had a question on it, believe me, someone before you did as well, and that's exactly what we're here to do, help streamline that process. Furthermore, applications are reviewed on an ongoing basis. So students are encouraged to apply early. We have, as you can see, the deadline to apply to start in the fall of this year is July 1st of this year. But the good thing is if you apply in advance, you can receive your decision in advance. Because we do only start 1 time per year, it is important that you are able to get your decision early on and prepare to be able to be ready to start the program September 3rd. So our academic year will start on a Tuesday this year, which will be September 3rd after the Labor Day holiday. And applications, again, are encouraged to come in early. Let us help you work on it early. That way you can get a decision early and have the whole summer to prepare for starting classes in the fall. To go over some of the tuition information, right now we are showing the 2018-2019 tuition, which is $1,128 per credit. So any tuition information that is changed on a year-by-year basis, that information is delivered in the early to late spring each year. So if there's going to be any changes for the 2019-2020 tuition, we will have that updated information on the website within the next few months. But essentially what still stands is the scholarship that we offer for this program. So it is a partial scholarship. It's called the Opal Scholarship, which is for our online programs of applied learning. And it is available to all students who are admitted to this program. It will cover automatically about $433 from every credit and leave students with the remaining $695 per credit. Now, at the current tuition rates for the 49 credits of this program, that would be about $34,055. Just to let students know, you do pay for the number of credits you take as you take it. So as Dr. Spiegel mentioned earlier when he was going over the curriculum, students do have the flexibility to decide at what pace they take the program. While classes are offered at certain times throughout the year, you can decide if you want to pace yourself and take 1 class at a time, or if that would essentially be taking the program over 4 years. but you can also do it in a 3-year format, or if you do it in the 2 as it's scheduled, you would be taking about 2 classes, about an average of 6 to 7 credits every 8 weeks, with no classes in the summer. So the term runs from September until mid to end of May, and then the summer months are off, and then students start again in the second year in September again. So with the admissions does come the scholarships. So if there's no additional forms to fill out, and beyond this partial scholarship, you're more than welcome to access the information for our financial aid office to look more into federal and private loans if you'd like to. The information is listed here on the bottom. You can feel free to take the phone number down as well as the email. And this information can also be accessed through our website. So to additionally talk about an additional scholarship, so the Opal Scholarship is a scholarship that is guaranteed for students who are admitted to this program. In addition, the Johns Hopkins Center for Humanitarian Health is also offering an additional scholarships for this program. Applicants from low and middle income countries have the opportunity to apply for this, and this $10,000 scholarship is dispersed over the entire length of the program. So students must meet all admissions requirements, reside in a low or middle income country, and your application does need to be submitted by May 1st. So you do have to submit your application in the SOPIS application portal by May 1st, and then have a fully complete application by May 31st. So, for example, if you submit by May 1st and one of your letters of recommendation is not in just yet, you're okay. They do have until the 31st of May to fill that out for you and submit it in. So you don't have to worry about that. Now, this is a separate scholarship. This is a separate competitive scholarship. So this will not be awarded to all students. Students do have to apply by May 1st, and they can be reviewed for this scholarship. With your admittance decision, you will be notified if you will be receiving this scholarship or not. So again, this is not a guaranteed scholarship. This is a competitive scholarship, but we do encourage students with qualified backgrounds to apply as soon as possible to be reviewed for that. Perfect. So at this time, we're going to open up for a Q&A session. I see we do have a couple of questions that have already come in. So I'm going to start off. I think this would be a great one for you to answer, Dr. Spiegel. A student asked, most of their work experience in this area has been volunteering and not in a paid professional environment. Can they still apply?
The answer is yes. I think a lot of it will depend on what sort of volunteer work they were doing, but also what your longer term goals are. I mean, we really want people that want to ultimately go into the field, meaning go outside of where they're living now and work in these humanitarian crises. But we've had in our first cohort many people that have volunteered, and we've also had many people that have worked in domestically in the US or in their home countries, but do want to make the transition to international humanitarian work. And that's absolutely fine, and we want that. But our goal ultimately is really to train the next humanitarian leaders. And so I think if you volunteered and you've had whether it be domestically or internationally, that would be wonderful.
Perfect. I think I can take or we can both talk to this next question. I've talked to students about what they've experienced in the classes, but you can also please share some details. I've seen asking how many hours per week are they expected to spend if they are taking the 2 classes as scheduled for the 2-year program. So if they're taking the 6 credits, what would be the recommendation on time to spend to be successful in their courses?
That's a hard.
I do have some feedback. I do have some feedback from students in the current program.
No.
Oh, go ahead.
No, please go ahead, because it would be good if you can get some feedback. I have some ideas, but I don't know all of the specifics. But I can complement what you say.
Perfect. So from some of the students that we've worked with in this past year, and on average, working with these type of online programs and similar number of credits, so this is across the board for a few different programs that I've worked with, including this one. Students said for an average, if you're taking the 2 classes, that's an average of 6 to 7 credits in an 8-week session. It would be recommended to see if you are able to spend about 18 to 20 hours a week on coursework. That's kind of the average time between reading assignments, writing assignments, recorded lectures, to be able to complete what you need to complete successfully. So for 2 classes, as far as I have been told, 18 to 20 hours would be a good fit to be successful in coursework. What are your thoughts, Dr. Spiegel?
Yeah, I mean, for 2 credit courses, generally it is 1.5 lectures or so, 1 lecture per week that is expected, and that's watching the lecture and then reading again the various. We have a mixture of required texts and then optional texts for your interest. And then generally, it depends on the course, but generally what we have are halfway through, around 4 weeks or 6 weeks, and then the final at the end of 8 weeks, there's an assignment. And depending on the course, but normally these assignments, we deliberately don't want 40-page papers. It's really often a case study where people have to use what they've learned and try to interpret it according to that context. So I think that sounds reasonable. And what I've seen, and even amongst the courses that I teach, I can see there are different levels of intensity within the various courses. So I think the epi and the biostats generally requires significantly more consistent work, because it's building upon one after the other in terms of concepts, where I've seen other students that binge on some of the lectures because they don't have the time to be able to do all of them in a regular basis. The other thing is we really encourage everyone to finish and meet the deadlines, but we do try to be flexible, and we've had numerous people. A couple people have had to deploy to DRC for Ebola and others situations. So we do have flexibility at least during the term to extend some of the requirements or the deadlines as needed, because we recognize many people are mature mid-career professionals.
That's great to hear, and I can echo that. Students have consistently mentioned great interactions they've had with faculty, just understanding that they are full-time working while pursuing this degree. I have another 2 questions that came in. I'm going to try and group these together. So for the individuals that are working within a medical background and asking these questions, I hope this answers your question, but if not, please feel free that we can connect with you offline as well. Just trying to, for sake of time, group both questions in. So Dr. Spiegel, what are your thoughts on someone with a medical background, like a physician coming into the program? Where do you feel like they would be able to be successful in the humanitarian health field? Like, what opportunities, would there still be opportunities for them having a medical background coming into this program?
Oh yeah, I mean, absolutely. Significant amount of our students, both in person and online, are doctors or nurses, and generally those folks recognize that they doing this degree and doing the MPH, that they're not going to be, it's not a clinical degree, so it's understanding the importance of the medical care, but then thinking in a public health way. So for those that have never been dealt in public health before, who are clinicians, doctors or nurses or physician assistants, it's a broadening experience. You know, you're not thinking, we don't think individually per patient. We think about the whole population. What are the best interventions that have evidence behind them that can help the most amount of people, which means that some specific people may not be helped, or we have to make very difficult decisions at times to make sure that we deal with the greater good. So absolutely, but just to clearly recognize, it's a broader look. You take into account politics, you take into account broad public health issues. That course that I mentioned from Gilbert Burnham does have some specifics in terms of clinical and tropical medicine components, but it's not meant for clinicians. So, I mean, to summarize, absolutely, but I think it's important to recognize, and I'm a medical doctor, but when I go into the field and respond to humanitarian emergencies, I don't treat patients individually. The national population does that. I work more on the strategy, on the various capacity building, and on the guidelines and implementation of the programs.
Perfect. Thank you so much. And I do encourage, I hope that was able to answer both of your questions, but again, we are happy to connect with you offline to kind of talk a little bit more in detail about all of this and answer any additional questions you have. I think one more question as far as the logistics of the coursework, Dr. Spiegel, a student's asking, how are exams delivered? While this is an application-focused program, I know it's not very heavy in testing, but any quizzes or exams that students may have, are they proctored or are they just delivered through Course Plus?
Right. So no, everything is delivered through Course Plus. For the most part, I'm trying to remember, but for the most part, we don't do quizzes. But even if we did, because we do that in other situations, it's all through Course Plus. Everything is open book. We're dealing with a mature population who are working, and so the issue isn't really, you know, the issue isn't to test knowledge. It's really to hopefully provide the knowledge and the context, and then it's to work with the student to try to have him or her apply it. So the courses that I've seen thus far, and I've done at least 2 out of the 3, they're assignments, we call them, not tests per se, and generally what we're doing, as I mentioned, is we're giving a scenario. So for the WASH course that I'm doing right now, for example, the first one has to do with the Rohingya refugees in Bangladesh that fled from Myanmar. And it's trying to apply the water and sanitation and hygiene components to that situation. We generally limit, for example, we say, I can't remember if it's exactly 2 or 3 pages, but we really limit the words and the pages because we're not interested in quantity. We just want to make sure that the students get it. And then the second one that we're doing is actually relates to, because we want to make everything up to date and applied. So we have just finished a very large report on the the cholera outbreak in Yemen for the Office of Foreign Disaster Assistance in the US, and ECHO and DFID in the UK and the EU. So this actually takes the brief summary. You have to read that summary, and then we ask specific questions about what would you do in that specific situation.
Perfect. Well, I think this is all the time we have for questions. I appreciate everyone who has participated and who has been part of the presentation tonight, especially Dr. Spiegel. Thank you so much for all the insightful information and all the details regarding the program, and appreciate you taking the time to present to our audience tonight.
It's an absolute pleasure. I'm glad. I wish we could see you and speak to you directly, but we're certainly around. And if you have other questions that are very much specific about the courses and what you're learning, some of us, certainly from the faculty, let Angelica and know, and Angelica and Megan, and then we can contact you and speak with you if that will help, because we really feel this is an important course, and we want to make sure that we train the next future humanitarian leaders. And so we're certainly happy to go out of our way to speak with you ahead of time to make sure that this course is a fit, or this master's degree is a fit for you.
Perfect. And I do echo that. You've been great with connecting with a lot of the students offline that I've worked with over the past year who have been applying to the program and had more specific questions. So thank you. I do echo his sentiments that if you have additional questions, if they were not answered, or if they were more specific to your background, please feel free to take down my phone number and my email that is listed here. I'm happy to connect with you personally to talk through any additional questions that you have. And if there's any questions that are more specific outside of the admissions that I can answer, Dr. Spiegel has always been very gracious to connect with students directly as well. But either way, my phone number and email is listed here. You will be getting a recording of this presentation sent out to you within the next few days. And if you've heard all this information and you're really excited and it's really connecting with your personal goals, your passion and interest, feel free to start the application. Anyone who starts an application is contacted by my office so that we can help you in the process. So feel free to scan below the QR code, and this will allow you to access the application portal and start the application. But again, you will be getting some emails and some more information sent from my office in the next couple of days. We appreciate your attendance and look forward to connecting with each of you personally and potentially helping you start this year. Thank you and have a great night.
Goodbye, everyone. Take care.